Hey friends, welcome back. If this is your first time here, I'm Dr. Rachel Fuentes and I am a veterinarian. And today I wanted to kind of give a little bit of a shout out to our new grads. We are in the end of May, heading into June, and we're heading into graduation season. And, we're going to have some fresh faced new veterinarians joining our colleague network soon. And so I really just kind of wanted to speak to them, to you, about your first jobs, about what to expect, what to look for, and things that were told and taught to me versus things I wish I knew. And I'll keep it as brief as possible. But I want to say congratulations to everybody, whether you're a veterinarian, a vet tech, a receptionist, kennel assistant, or in any field whatsoever. If you are graduating school at whatever level this coming season, congratulations. Education is hard and takes a lot of dedication, especially over the last year with the craziness of the world. So kudos to you for getting it done. And I'm going to talk a little bit about what to expect as a new baby vet. That your first job really prepares you and dictates much of how you will practice for your career. Now, obviously, things change, things are in flux, but that first job that you get, it's going to teach you kind of the ins and outs of the everyday appointment. It's going to expose you to the medications that you're going to be using every day, the length of appointments that you're going to be getting used to, so the speed at which you do things. It's going to get you kind of used to whether you realize you love surgery or you love internal medicine or you love acupuncture. So that first job gives you so much. So, when you're looking for it, few things to look at and for. Okay. The first one is mentorship. Now, mentorship can look like many things. There are some practices that prefer a more formal mentorship where you will set aside time with a designated person, usually either the owner of the hospital or the medical director, or somebody that's been there for a number of years and has lots of experience in the field. And that there is dedicated time set aside for you to both sit down, talk about cases that you've seen, go through some of the records that you've written, evaluate and reassess what you've done fantastically and what could be an area for improvement on for next time. You may go through different journal articles or have morbidity mortality rounds and have it as a very formal kind of a thing. And then there could be a very informal kind of mentorship where you essentially pick each other's brains. I don't recommend doing that if there's a million things going on. If there's who's doing surgery and something is crashing over there and the appointments are backed up over there and everybody's on the phone over there and the lab isn't working. That's not the time to try to discuss your cases unless it's an emergency. But there are so many opportunities to speak to your colleagues, to talk to your other fellow DVMs and ask them their thoughts. What have they done? Hey, I just saw this 15-year-old dog for increased drinking, increased urination. I think it has diabetes and I want to start him on insulin. I looked up the dose to start, but I'm not really sure because it's in between. Should I round up? Should I round down? What do you usually do? You know, your fellow veterinarians are a wealth of knowledge because they're coming with their experience. That is invaluable, and you should always look to have these discussions. I've said it before, I will say it again. Vet med is not a solo sport. So be open to talking to your colleagues, and even if they're not super experienced and they have only been in the field for only a year or two, that's okay, because it is all about discussion. You know, you can always go back to your textbooks, which are of course always going to be a valuable resource. But having that communication with your colleagues, chef's kiss, is exactly what you need. Something else that's really important, and I think this can serve you not only in the beginning of your career, but of course throughout, is listening to your technicians. I was a technician, a licensed vet tech, prior to becoming a veterinarian, so obviously I have some bias there. But there are technicians that are wealths of information. So many of them have been doing this job and working in this field for decades. And even though they did not go to vet school and they are not doctors, they have seen the patterns. They know these patients. Listening to what they say is supremely valuable. That said, that comes with a caveat. Do not be bullied by them. It is very easy, especially as a new veterinarian. It happened to me that you listen to what your technicians are saying and it sounds reasonable. You know, sounds like they know what they're talking about, and you make decisions based upon that. You need to evaluate for yourself if you are comfortable with what they're saying, if you are on board ethically with what they're saying, and if it sounds medically appropriate. When in doubt, step out of the situation, excuse yourself for a moment. Hey, you know, I have to go over there. You know, I got to run to the bathroom or whatever. And look it up. You know, you, at the end of the day, are the doctor. And even though your technicians are hugely valuable resources and have a wealth of information from themselves, it all comes down to you at the end of the day. It is your license. Those are your decisions. And if you feel like you're being pushed into making a decision, whether it's sedating an animal that shouldn't be sedated because of health reasons, or not doing a diagnostic test because it costs too much money, the owner doesn't have that money, doesn't have those funds, so let's just give them the medication anyway. Or you should not euthanize that animal for whatever reasons they think. You know, you really need to listen to them, take that in, but then come up with your own answer. Because you know what, you're right, that client may not have the money for the big test. However, you can't just send home a medication because you feel bad, because you might be wrong. And then that client may sue you. You can't just not euthanize something because the technician feels bad when you know that it's the medically appropriate thing to do. You know, so it's a balance of listen to them. They are valuable. These are your people. And understanding that you still need to decide at the end of the day how you're going to proceed with your cases. Something to look at when you're looking for jobs. At the end of the day, this is still a job. And even though we love what we do, and that's why we do this, because obviously veterinarians, though you can make a very good living, this is not exactly the most lucrative position to be in. When you are looking for jobs and you're looking for compensation, absolutely, absolutely, absolutely know your worth. You can go to the AVMA website. I will leave a link to it down below. And there is an estimated salary calculator for whatever state you're in, if you're in the United States, with how many hours you work and whether you're companion animal, equine, etc. And that should help kind of guide you a little bit. Those are not hard and fast numbers, but they help. That said, when you're looking, there are offers that seem really good. You know, if it's X amount of money plus a sign-on bonus, right? And these sign-on bonuses can range anywhere from a few $100s to a few $1,000s. It's your salary plus relocation bonus. Your salary plus dividends, you know, if it's a corporation. And those are great options. I encourage you to look into that and to weigh your options. That said, you should also question, why are they offering that bonus? Most animal hospitals, when they are looking for somebody, and it's a normal kind of general practice situation, full-time, you know, very standard, they're not going to add those extra bonuses. They start adding those extra bonuses when things are suboptimal, whether it is they can't find somebody, whether that's just because of the region, because of what's going on in the world, for whatever reason, they're unable to fill the position the way they normally would. So they need to add a little bit of an extra incentive. Sometimes it's because they know that the position comes with extra stressors, whether those stressors are less technicians per doctor, more appointments per hour, longer hours than standard. You know, those are things to ask, you know, and to think about and consider when you're applying to these positions. Again, it is imperative that you are paid what you are worth, and you should look into your options. However, if something seems a little extra shiny, it's like, oh, a $10,000 sign-on bonus, you just kind of keep back here somewhere that there might be a reason that they need to make that offer extra shiny. All right, and lastly, set boundaries for yourself. Again, easier said than done. I'm just learning how to do this. And I've been in this field now for many years, multiple decades. And so set boundaries. It is very easy because, again, we love what we do. We love the medicine. We love the animals. We love the people. We love the hospitals that we're at. You know, it's very easy to say yes. Yes, I'll come in earlier. Yes, I'll stay later. Yes, I'm going to work through my lunch break. Yes, I will come in on my day off. Yes, I will cover that extra shift without extra pay because I'm salaried. It is very hard to say no, especially early in your career. And unfortunately, very honestly, there is still a level of paying your dues, you know, where the baby vets, and I say baby vet with love, you know, essentially it's just a new vet, where baby vets are kind of expected, or it's anticipated that they do some of the grunt work that the more experienced vets may not want to do. It's a toxic kind of cycle. I don't think it's very reasonable. Just because I've suffered doesn't mean you have to suffer. Just because I was working 80 hours a week does not mean that you need to work 80 hours a week. However, there are still people that think like that. So set your boundaries. Be flexible, especially if this is your first job, obviously, because flexibility and being a team player is important no matter where you are, and no matter where you are in your career and rung of the ladder and hierarchy and whatever. So always be a team player. However, you have sacrificed to be here. You have sacrificed time, money, probably relationships with family, friends, romantic relationships. You have spent the time and the effort to become a veterinarian, and you deserve that balance of being able to do what you love and do what you've gone to school for and graduated and are excited about and are passionate about. But you also deserve to sleep. You deserve to have rotating weekends. You deserve to eat dinner with your family on days that you don't have a late shift. And again, it's so easy for us to say yes. Keep in mind that, again, being a team player is fantastic, and you should always strive to do the best that you can in no matter where you are, and all of that wonderful feel good stuff. But also, don't be taken advantage of. It is easy for employers to ask you to do things, to stay longer, stay later, work through, come in, those kinds of things. Because if they don't ask, they're not going to get that answer. You can say no. And again, find that balance, figure out what your boundaries are as far as work life and what you're looking for in your professional career. And you will be set up for a great start. I just want to say congratulations to all of the new graduates, our veterinarians, our vet techs, and again, anybody that has graduated from any kind of a program, pre-K all the way through to an advanced degree. You've worked for this. You've worked for this moment, and you deserve to smile, enjoy, revel in it. And I wish you all the best moving forward with your career, and I'll see you next time.